when you talked about plans to double the number of fully functional primary healthcare centers, I think you gave a figure of from 8,000 plus to 17,000 plus, correct me if I'm wrong, in 4 years. When you say fully functional, what does that really mean? Are you suggesting that there are 8,000 plus primary healthcare centers across the country that are operating optimally with adequate facilities and qualified personnel?
The first set within that 8,000, the previous administration tried to revitalize. I think they did about 3,500. And some of those, we'll look at them to see whether they are fully functional. So our first goal will be to get to the 8,000 and then double over 4 years. And it's an incremental process, but at least we've got that target. And that the accountability framework that has now been concluded through this compact allows us to track the progress transparently and make it visible to the public, to our partners, to the state government, and to Nigerians overall in terms of the progress that we're going to make it. Now, it's very audacious that we're saying that we're going to do this and be visible about it because we think it has to be done for Nigerian health system to improve the way we want it to. So I think the commitment we made is not done lightly. And I do believe that Mr. President is extremely serious, that he wants the health system to be transformed in a way that serves the health needs of Nigerians. And that is what we are committed to do. And together with the state government and our development partners, we've now signed the compact. In other words, we are now all pregnant. We have to deliver on this commitment that has been made.
How precisely with this investment initiative impacts significantly on the number of Nigerians captured within the National Health Insurance Scheme, which we understand is still quite below the 10% mark?
Yes, for Nigeria's journey in health insurance has been a very long one. It's more than 20-something years in the making. It's been slow and arduous. 2022 was a landmark with the National Health Insurance Authority Act that was passed and signed into law that made health insurance mandatory. Now, there are elements of that that will have to be executed alongside the state health insurance authorities, and we'll need to look at the guidelines for operationalizing that law. But at the core of it, there needs to be more public revenue to target the poorest and most vulnerable, and we need to raise those resources. And in the context of this effort, the BHCPF will contribute to the Vulnerable Groups Fund, but it goes beyond what the BHCPF provides. It's not enough by itself to get to the target. So innovative financing will have to be considered. And I had mentioned some of those that I believe the state governments are also showing increasing appetite to look at that. And we are putting some resources from the federal government side to add to the Vulnerable Groups Fund so that all of those will add up to more people having affordable access to quality health care over time. It's not going to be overnight, because if it was going to be easy, it should have been done over the last 20 years. It wasn't. But here we have an administration and a president who is committed before the elections and after the elections in terms of doing what is necessary to make healthcare more affordable, especially for the poorest and most vulnerable Nigerians.
You know what, Prof? We decided to open this conversation to our viewers and ask them to send in some questions they have for you using the hashtag Beyond 100 Days on X, formerly Twitter. One of them at Camp Patriot is asking, what are your plans for universal health for all, where citizens can subscribe at a fee that doesn't hurt to enable them access healthcare whenever and wherever in Nigeria? And she's saying, is there a way to end or extremely minimize out-of-pocket payment for health services?
The way to do it is to expand health insurance coverage. And the Health Act I mentioned provided for mandatory coverage by all employers, but also for private health insurance through the HMOs, so that individuals can subscribe and be able to get the coverage for the service that they're in need of. From the public sector side, we're looking at the basic package, a refined basic package that is affordable. Before now, most of the analysis, the costing of that package, the composition of that package has been many years and many parameters had changed. So we're going to refine that so that an affordable basic package is available and individuals can overlay on top of that with private health insurance if they need, so that when they require sophisticated healthcare, they can be able to have that more affordably. That is the step, one more step, advancing Nigeria's move towards universal health coverage. It will take time. And just to say that the UHC aspiration is one that all countries in the world have agreed to, but many countries are still struggling to get there. But we're seeing Nigeria now coming together between the federal government, states, development partners, and citizens saying, look, we need to move faster in that direction. And I believe that you will see incremental progress, and even beyond incremental progress, significant progress, if all of us agree to subscribe to the health insurance efforts.
We're looking forward to that. There's an interesting one here from Adegboyega Abiola, who says, what are the plans you have in place to ensure that we have facilities here that will deter our public office holders from traveling abroad for medics? And, you know, they say rich men can trust doctors here to treat malaria, but when it comes to terminal diseases and illnesses, they fly out. How do you react to that?
So in the proposal for our 2024 appropriation, again, thanks to Mr. President's leadership and direction in revamping, renewing the health sector, you're going to see federal government investing significantly in the infrastructure for cancer care in the 6 geopolitical zones. The physical infrastructure, but the equipment for cancer care, such as linear accelerators. People don't have to travel to other African countries or to the Middle East or Europe to have care for such devastating and high-cost illnesses like cancer, which is unfortunate for anyone who is affected. So that's just one element. We're going to see revamping of the physical infrastructure and equipment in many of our teaching hospitals, our federal medical centers, and our specialty hospitals. You're going to see retraining of our healthcare workers so that they are tooled, they are retooled, skilled to deliver higher quality care. You're going to see partnerships with the private sector in terms of the infrastructure for delivery of health services. We're discussing with some high-end, in fact, one of the best healthcare providers in the world